Have you ever brushed off a sudden dizzy spell or blamed a numb hand on sleeping in an awkward position? Many people do. But after the age of 60, some symptoms that seem small or temporary can be your body's way of asking for urgent attention. One of the most dangerous things about a stroke is that it doesn't always begin with dramatic warning signs. Sometimes it starts with subtle changes that last only a few minutes. Because they disappear so quickly, many people ignore them. Sadly, that can be a life-changing mistake. The good news is that your body often gives you a chance to act before permanent damage occurs. Recognizing these early warning signs and getting medical help right away can make a remarkable difference. In many cases, quick treatment can reduce brain damage, improve recovery, and even save a life. Today we'll go through 7 early stroke warning signs that everyone over 60 should know. Some may surprise you because they don't always look the way people expect. And make sure you stay until the end because the final warning sign is one that many older adults mistake for simple fatigue or aging. Let's begin. As we get older, our risk of stroke naturally increases. Changes in our blood vessels, along with conditions like high blood pressure, diabetes, high cholesterol, and irregular heart rhythms can all raise that risk. But having risk factors doesn't mean a stroke is inevitable. It means being informed becomes even more important. A stroke happens when part of the brain suddenly stops getting enough blood and oxygen. This can occur because a blood vessel becomes blocked, or, less commonly, because a blood vessel bursts. Brain cells begin to suffer within minutes. That's why doctors often say, time is brain. The sooner treatment begins, the better the chances of protecting brain function. It's also worth mentioning something called a transient ischemic attack, often called a TIA, or a mini-stroke. A TIA causes temporary stroke-like symptoms that usually go away within minutes or hours. Even though the symptoms disappear, a TIA is a serious warning that a full stroke could happen soon. It should always be treated as a medical emergency. Now, let's look at the first warning sign. The first warning sign is sudden numbness or weakness on one side of the body. Imagine you're pouring your morning coffee when your right hand suddenly feels unusually weak. Maybe the cup slips slightly, or perhaps your left leg suddenly feels heavy as you stand up. You might even notice that one side of your face feels different, almost as if it's asleep. Many people assume this happens because they slept in a strange position or because of arthritis. But when numbness or weakness appears suddenly, especially on only one side of the body, it deserves immediate attention. The reason this happens is surprisingly simple. Different parts of the brain control movement and feeling on opposite sides of the body. If blood flow is interrupted to one of those areas, the signals between your brain and muscles may stop working properly. The weakness may be dramatic, making it impossible to lift an arm, or it may be subtle, making simple tasks feel unusually awkward. A quick way to check is to raise both arms at the same time. If one arm drifts downward or feels much weaker than the other, don't wait to see if it improves. Call emergency medical services immediately. Even if the weakness disappears after a few minutes, it should never be ignored. Temporary symptoms can still signal a TIA, which greatly increases the risk of a larger stroke in the following hours or days. As important as weakness is, the next warning sign can be even easier to overlook because many people mistake it for normal aging. The second warning sign is sudden trouble speaking or understanding words. Have you ever known exactly what you wanted to say but couldn't get the words out? Or perhaps someone spoke to you and their words suddenly seemed confusing even though your hearing was fine. These changes can happen when a stroke affects the parts of the brain responsible for language. Sometimes speech becomes slurred, almost as if the person has had too much to drink. Other times, words come out mixed up or don't make sense. In some cases, a person may understand what others are saying, but struggle to respond. Family members are often the first to notice something isn't right. They may hear unusual pauses, incorrect words, or sentences that sound confusing. If this ever happens suddenly, don't assume it's just tiredness or stress. A sudden change in speech is one of the classic warning signs of a stroke. Doctors often recommend remembering the simple acronym FAST. F stands for face. Ask the person to smile. Does one side of the face droop? A stands for arms. Can they raise both arms evenly? S stands for speech. Is their speech slurred or difficult to understand? T stands for time. If you notice any of these signs, it's time to call emergency services immediately. FAST has helped countless people recognize strokes quickly, but it doesn't cover every possible symptom. That's why learning the additional warning signs is so valuable. The third warning sign is sudden vision changes. Many people expect vision problems to develop gradually as they age. Cataracts, age-related macular changes, and the need for stronger glasses usually happen over months or years. Stroke-related vision changes are different because they happen suddenly. One moment you may be reading the newspaper or watching television. The next, part of your vision seems missing. Some people lose vision in one eye, others experience blurred vision or even double vision. These changes occur because the brain processes what your eyes see. Even when your eyes are healthy, interrupted blood flow to certain areas of the brain can suddenly affect vision. Some people describe it as a curtain coming down over one eye. Others notice that they keep bumping into objects on one side because they can't see them clearly anymore. Because these symptoms may not be painful, they're often ignored. Someone might decide to rest, hoping their eyesight returns to normal, but waiting could allow more brain cells to be damaged. If you experience sudden vision loss, double vision, or unexplained blurred vision, especially when it occurs along with weakness, numbness, or speech problems, seek emergency medical care without delay. And we're only halfway through the warning signs. Next, we'll discuss a symptom that many older adults dismiss as an inner ear problem, or simply getting older. Yet it can sometimes be one of the earliest clues that the brain isn't getting the blood flow it needs. Understanding the difference could help you or someone you love recognize a stroke when every minute matters. Let's continue with the fourth warning sign. The fourth warning sign is sudden dizziness, loss of balance, or difficulty walking. Most of us have experienced dizziness at some point. Maybe we stood up too quickly, skipped a meal, or became dehydrated on a hot day. Those situations are common, and in many cases, the dizziness passes once the underlying cause is corrected. But stroke-related dizziness is different. Imagine you're walking across your living room, and all of a sudden, the room seems to spin. You feel unsteady on your feet, almost as if the floor is moving beneath you. You reach for a chair or the wall because you're afraid you might fall. For some people, it's not a spinning sensation at all. Instead, they suddenly lose their balance for no obvious reason. They may stagger while walking, drift to one side, or feel as though they have no control over their movements. These symptoms can happen when a stroke affects the back part of the brain, an area called the cerebellum. This region helps coordinate balance, posture, and smooth movement. When blood flow to this area is interrupted, even simple tasks like standing or walking can become difficult. The challenge is that dizziness has many possible causes. Inner ear problems, certain medications, dehydration, and low blood pressure can all make someone feel lightheaded. That makes it easy to dismiss dizziness as something harmless. The key difference is that stroke symptoms usually appear suddenly and often occur alongside other warning signs. For example, dizziness combined with slurred speech, double vision, weakness, numbness, or trouble walking should never be ignored. Here's an example. A 72-year-old man is getting ready for his morning walk. As he steps outside, he suddenly feels off balance. He assumes it's because he didn't sleep well. Instead of asking for help, he decides to sit down and wait. An hour later, his speech becomes slurred and his right arm feels weak. What seemed like a minor balance problem was actually the beginning of a stroke. The lesson isn't to panic every time you feel dizzy. It's to pay attention when dizziness is sudden, severe, unusual for you, or accompanied by other neurological symptoms. In those situations, getting emergency medical care right away is the safest decision. As serious as balance problems are, the next warning sign surprises many people because it doesn't happen with every stroke. But when it does occur, it's often unforgettable. The fifth warning sign is a sudden, severe headache unlike your usual headaches. Not every stroke causes pain. In fact, many strokes happen without any headache at all, but some strokes, especially those involving bleeding in the brain, can begin with an intense headache that comes on very quickly. People often describe it as the worst headache of their life. Imagine enjoying a quiet afternoon when, within seconds, a powerful headache strikes out of nowhere. It isn't the dull ache you've had before. It's sharp, intense, and unlike anything you've experienced. The headache may be accompanied by nausea, vomiting, blurred vision, confusion, neck stiffness, or sensitivity to light. Some people even lose consciousness. Because headaches are so common, many people reach for pain medicine and decide to lie down. But when a headache is sudden, extremely severe, and different from your normal pattern, especially if it appears with other stroke symptoms, it needs immediate medical evaluation. Doctors look carefully at the whole picture. They consider the person's age, medical history, blood pressure, medications, and any additional symptoms before determining the cause. That's why it's never wise to diagnose yourself at home when symptoms are sudden and severe. Even if it turns out not to be a stroke, it's much safer to be evaluated quickly than to risk delaying treatment for a serious condition. Now, let's move to another warning sign that can be surprisingly subtle, especially for people living alone. The sixth warning sign is sudden confusion or trouble understanding what's happening around you. This symptom doesn't always look dramatic. Someone may suddenly seem distracted, forget what they're doing, or struggle to follow a simple conversation. Imagine a woman preparing lunch. She's made the same recipe hundreds of times, but suddenly she can't remember the next step. She looks at the ingredients and seems unsure why they're on the counter. Or perhaps someone is speaking to her, and although she hears the words, they no longer make sense. Family members might notice something first. They may ask a simple question like, "What day is it?" Or, "Can you hand me your glasses?" Instead of answering normally, the person responds with unrelated words or stares blankly in confusion. This kind of sudden mental change should never be dismissed as ordinary aging. Normal aging may involve occasionally forgetting a name or misplacing the car keys. Those small lapses usually improve after a few moments. Stroke-related confusion is different because it begins suddenly and represents a noticeable change from the person's usual thinking. The brain depends on a constant supply of oxygen-rich blood to function properly. When that supply is interrupted, areas responsible for attention, understanding, memory, and decision-making may stop working normally. Some people become unusually sleepy. Others appear restless or disoriented. Some repeat the same question over and over because they cannot remember the answer. If someone suddenly seems confused, cannot follow instructions, struggles to understand language, or behaves in a way that is completely out of character, it's important to treat the situation seriously. It's especially important not to assume they're just tired or having a senior moment. Unfortunately, confusion can be easy to overlook because it doesn't always involve obvious physical weakness. That's one reason strokes affecting certain parts of the brain may be diagnosed later than they should be. If you're with a loved one and notice sudden confusion, ask a few simple questions. Can they tell you their name? Do they know where they are? Can they follow a basic instruction like raising both hands? These aren't meant to replace medical evaluation, but they may help you recognize that something is wrong while emergency help is on the way. By now, you've probably noticed something important. None of these warning signs should be viewed in isolation. A stroke may cause just one symptom, or it may cause several at the same time. One person may only have slurred speech. Another may only lose vision in one eye. Someone else may experience dizziness, confusion, and difficulty walking without any weakness at all. That's why it's so important to pay attention to sudden changes, especially when they affect the brain's normal functions. Many people wait because they hope the symptoms will disappear. Sometimes they do. But even temporary symptoms can be a warning that a more serious stroke could happen soon. Getting evaluated quickly gives doctors the best opportunity to determine what's happening and, if appropriate, begin time-sensitive treatment. There's one final warning sign we haven't discussed yet. It's one of the easiest to dismiss because many people blame it on exhaustion, aging, or simply having an off day. Yet recognizing it could make all the difference when every minute counts. Let's look at that final warning sign next, and then we'll cover several practical steps that may help lower your stroke risk and explain exactly when you should call emergency services without hesitation. Let's finish with the seventh warning sign. The seventh warning sign is sudden, unusual fatigue, or a feeling that something is deeply wrong. At first, this may not sound like a stroke symptom. After all, everyone feels tired now and then. But some people describe a very different experience in the hours leading up to or during a stroke. They may suddenly feel overwhelmingly exhausted, even after a good night's sleep. Others say they have a strong sense that something isn't right, even if they can't explain exactly what they feel. This warning sign is especially tricky because fatigue has so many possible causes. Poor sleep, dehydration, infections, medications, and many chronic health conditions can all leave someone feeling worn out. That's why fatigue alone does not mean a person is having a stroke. The important point is this: when unusual fatigue appears suddenly and is accompanied by any of the warning signs we've discussed, such as weakness, numbness, vision changes, confusion, dizziness, trouble speaking, or a severe headache, it should never be ignored. Think about someone who wakes up feeling unusually drained. They struggle to get out of bed, not because they stayed up late, but because something feels different. As the morning goes on, they begin speaking more slowly, or one side of their body feels slightly weaker. At that point, the combination of symptoms becomes much more concerning than tiredness alone. Many stroke survivors later say they knew something felt wrong before they understood what was happening. Listening to your body and acting when symptoms are sudden and unusual can make a tremendous difference. Now that we've covered all 7 warning signs, let's talk about what you should do if you or someone nearby experiences any of them. The most important message is simple: don't wait to see if the symptoms improve. One of the biggest mistakes people make is hoping the symptoms will disappear on their own. Someone may think, "I'll wait until after lunch," or "I'll sleep for a while and see if I feel better." Others don't want to bother family members or call an ambulance because they worry it could be a false alarm. But when it comes to a possible stroke, every minute matters. Doctors often say, "Time is brain," because brain cells begin to die when they're deprived of oxygen. The longer blood flow is interrupted, the greater the risk of permanent damage. The good news is that modern medicine has treatments that may help some people, especially when they arrive at the hospital quickly. Certain medications can help dissolve blood clots in carefully selected patients, and some people may benefit from procedures that remove larger clots. However, these treatments are only appropriate in specific situations and usually must be started within a limited time window after symptoms begin. That's why recognizing the warning signs early is so important. If you notice symptoms, call your local emergency medical services immediately rather than trying to drive yourself to the hospital. Emergency medical teams can begin assessing the situation right away, notify the hospital that a possible stroke patient is arriving, and provide care during transport if needed. If the symptoms happen to someone else, stay with them. Help them sit or lie down in a safe position if they are feeling weak or dizzy. Try to note the time when the symptoms first started, or when the person was last known to be well. This information can be extremely valuable for the medical team. Avoid giving food, drinks, or medications unless instructed by healthcare professionals, especially if the person is having trouble swallowing. Remaining calm can also help. While a possible stroke is an emergency, staying composed allows you to communicate clearly with emergency responders and provide accurate information. Although we can't eliminate every risk, there are many practical steps that can help reduce the chance of having a stroke over time. One of the most important is keeping blood pressure under control. High blood pressure is the leading risk factor for stroke because it places extra strain on the blood vessels throughout the body, including those that supply the brain. Many people don't realize they have high blood pressure because it often causes no symptoms. That's why regular checkups are so valuable. Managing diabetes is another important step. Keeping blood sugar within the target range recommended by your healthcare provider helps protect blood vessels and supports overall cardiovascular health. If you've been prescribed medication for blood pressure, cholesterol, diabetes, or an irregular heartbeat, taking it as directed is an important part of reducing stroke risk. If you ever have concerns about side effects, talk with your healthcare provider before making changes on your own. Staying physically active also plays an important role. You don't have to run marathons to benefit. For many older adults, activities like walking, swimming, cycling, gardening, or gentle strength exercises can support heart and blood vessel health. Even short periods of movement throughout the day can add up. Eating a balanced diet rich in vegetables, fruits, whole grains, beans, nuts, fish, and other lean sources of protein can also support healthy blood vessels. Limiting excess salt, added sugars, and highly processed foods may help many people manage blood pressure and overall heart health. If you smoke, seeking support to quit is one of the most powerful steps you can take for your brain, heart, and circulation. And if you drink alcohol, doing so in moderation, or avoiding it altogether if advised by your healthcare provider, may also reduce health risks. Sleep matters too. Conditions like obstructive sleep apnea, where breathing repeatedly stops during sleep, have been linked with a higher risk of stroke. Loud snoring, choking during sleep, or excessive daytime sleepiness are worth discussing with a healthcare professional. Regular medical checkups become increasingly important as we get older. They provide an opportunity to monitor blood pressure, cholesterol, blood sugar, heart rhythm, and other factors that may increase stroke risk long before symptoms appear. It's also important to remember that strokes don't always happen to people who look unhealthy. Some people are active, eat well, and still experience a stroke because of factors such as age, genetics, or underlying medical conditions. That's why knowing the warning signs is valuable for everyone. Let's quickly review what we've learned today. Never ignore sudden weakness or numbness on one side of the body. Take sudden trouble speaking or understanding language seriously. Pay attention to sudden vision changes. Don't dismiss unexpected dizziness, loss of balance, or difficulty walking. A sudden severe headache that's unlike your usual headaches deserves immediate medical evaluation. Sudden confusion or changes in thinking should never be brushed aside as normal aging. And unusual fatigue, especially when it appears alongside other neurological symptoms, may be another important clue that something is wrong. The common thread running through all these warning signs is that they appear suddenly. When your brain sends an unexpected signal that something has changed, it's always better to seek prompt medical attention than to hope the symptoms simply go away. No video can diagnose a stroke, and many of these symptoms can have other causes. But because stroke is a medical emergency, it's essential to let trained healthcare professionals determine what's happening as quickly as possible. If today's video helped you better understand these warning signs, consider sharing it with someone you care about. A family member, friend, neighbor, or caregiver may one day recognize these symptoms because of what they've learned today. And before you go, we'd love to hear from you. How old are you, and which warning sign surprised you the most? If you have a personal experience with stroke, whether your own or someone close to you, feel free to share it in the comments. Your story may encourage someone else to recognize the signs sooner and seek help when it matters most. Thank you for spending this time with us. Take good care of yourself, stay informed, and remember that small steps toward protecting your health today can make a meaningful difference in the years ahead. We'll see you in the next video.